treat addictive behaviors, trauma, and clinical depression?
All those three conditions, trauma, clinical depression, and addictive behaviors, that is also tied into a lack of neurogenesis, or a lack in a particular part of the brain, this part of the brain called the hippocampus. And
Yeah.
when when there's when it's not functioning properly, it can be associated with these diseases, particularly alcoholism and so forth. What's interesting is those three conditions, uh, in early research into psychedelic drugs, particularly LSD going back to the 1950s, showed promise for trauma, addiction, and substance abuse, or
Yeah.
depression, I should say. And there's a reason for that. Is that the what scientists refer to as the endocannabinoid system, which
Yeah.
CBD and THC interacts with, regulates processes, physiological processes that are implicated in all those conditions. And the psychedelic drugs work in part through that same condition. So, I mean, addiction is very, very complicated and complex, and difficult. One area that's been of interest recently to scientists and medical researchers with respect to CBD and addiction
Yeah.
in particular, um, has to do with CBD's ability to um, kind of modify one's memory, environmental memory. What I mean by that, if one is involved with an addictive substance, and let's say you go to rehab
Yeah.
and you come out and you're clean, but you go back into the same exact situation, the same environment, the same setting you were, in which the addiction took root.
Yeah.
Um, what CBD seems to do, at least according to animal studies, it breaks the connection, the memory of the addiction with that place.
Yeah.
So it has an anti-addictive property in that sense. And there's been quite a bit of animal research, preclinical research on cocaine addiction, and methamphetamine, um, alcohol, of course, and even for, let's say, habitual marijuana use. So that's a whole other discussion, that because
Yeah.
some of the research there is really kind of crazy, but which shows that CBD would be helpful. But again, this research has been primarily focused on animals, and you can't necessarily jump from animal studies to people. And
Yeah.
assume that the same things will happen. But I think from what we hear anecdotally from people themselves, um, at Project CBD, the organization that I work with, is an educational platform. We get a lot of reports that CBD is helpful for addictive situations. Obviously, opiate addiction is a major problem, and for that, it's not just CBD. THC could be helpful as well, because
Yeah.
if you're dealing with opiate addiction, it started, or it very possibly started, with a pain syndrome. You took opiates because you were prescribed it by your doctor to deal with pain. Unfortunately, opiates don't really deal with chronic pain very well. And you can get into a very vicious cycle where you're taking more and more, et cetera, overdose deaths. Uh, and I think this is another area where cannabinoids like CBD and THC can be helpful, because what we understand to be the case is that when THC is combined with opiates, it lowers the amount of opiates one needs to get the same results in terms of the pain-killing properties.
Yeah.
So if you could take something with your opiate regimen that would reduce the necessary dose of the opiates and yet still deliver the same effect, that will lower the odds, lower the likelihood of a fatal overdose, and that's a very positive thing, in and of itself.